skill, I'm going to show you how to take a patient's weight. The scales that we use here on campus and that you'll use for the headmaster test is this old-fashioned scale that you probably don't see too often anymore. It'll either be one of these calibrated scales or an analog scale. This is the one that we use here at Southwest Tech. So the first thing that I want to do is I want to make sure that my patient has shoes on, okay? Normally you think if you take your weight you don't want shoes on, but we are going to be walking the patient over to the scale, so I want to make sure he has shoes on. For this skill, for the headmaster skills as well, the patient is ambulatory, so he can walk on his own. Alright, so we're going to go ahead and get your weight today, okay? So come on over here, and before you step on there, I'm going to make sure that the scale is zeroed out. So in order to do that, I'm going to turn this a little bit here. I'm just going to move these weights and make sure they're both on 0. So the scale is now zeroed. I'm going to help my patient go ahead and stand on the scale. While he's standing there, the first thing that I'm going to do is I'm going to move the large weight at the bottom. The large weight at the bottom is 50 pounds. So I'm going to move it over one, move it over again, and now it dropped down, so I'm going to bring it back. Then we do the single pounds on the top, and we just move it down a little bit until it drops down, and then I'm going to move it back slowly until it starts coming up. And I'll show you this in just a minute. You want to have so that when the weight is going up and down, it should be in the middle of this spot. It may waver a little bit. When the patient moves a little bit, it's going to move. So you want it to have it there and it kind of stays there. Once it's where it needs to be, you're going to ask your person to step back. And you can go ahead and have a seat. For this, I can go ahead and I can read this now. So the bottom is the 50-pound increments. So it is at 100 pounds on the bottom. The top then is the individual pounds. So right now it is 30 pounds, 30.5. So you add those together, his weight would be 130.5 pounds. And when you're in lab setting, you'll be able to see this up close. Also review in your textbook of how it looks, because there are little dashes in between here that stand for the 0.25 pounds. So that's what it is, 130.5 pounds for my patient that I'm going to write down with pounds as my label. So that is how you do a weight for the headmaster exam. There's going to be, in most nursing homes, they have the electronic scales that you'll use, and during clinical and during your job orientation, you're going to be able to see that. The other thing that we can do for our patients is we do pulse and respirations. When you do pulse and respirations for your patients, you will do a radial pulse on them. Your radial pulse is on the thumb side of your wrist, okay? So you have temporal pulses on your temples that you can feel. You have carotid that you can feel. Brachial is going to be in your arm. Radial is going to be in your wrist. If you go on your thumb side of your wrist, you can use your fingers. Don't use your thumb, because if you use your thumb, you can feel your own pulse through there. So you use your fingers, and if you push down, sometimes you have to push down more for people, sometimes you can push down less. If you push down a little bit, you will feel your pulse. When you're getting a pulse on a patient, you will do that for them. So I'm just going to have him relax his hand, and I'm going to go on the thumb side here, and I'm going to find his pulse. Once you find it, don't push too hard, just push enough that you can feel it, because if you push down too much, you'll block it off and then you won't feel it at all. So I'm going to find his radial pulse. Once I have found that, I will use either a watch or I can use the clock on the wall. In lab setting and clinical, you do want to have a watch with the second hand on it. And I want to count his heartbeats for 1 full minute. We don't do it for 30 seconds and times it by 2. We count it for 1 full minute, because sometimes your heart rate goes up and down. All right, so I'm just going to go ahead. I'm going to find his heart rate, and I will look at the clock and I'll count for 1 full minute. When I get that recorded for his pulse, I'll write down his pulse rate and put beats per minute, or BPM. For respirations, it's when you watch a person breathe. Sometimes you can see a person breathe from their shoulders going up and down, their stomach moving in and out, or their chest rising. So when you do respirations, you want to make sure that you can see that person breathe. When you count respirations, 1 respiration is breathing in and breathing out. That's 1 respiration. So if we watch our patient and we watch him where he breathes in and he breathes out, that's 1 respiration. In normal circumstances, you don't want the person to know you're watching them breathe, because it's kind of an awkward feeling. If you're doing this in the nursing home setting, maybe you're going to watch them from the doorway and you're going to watch respirations. In the clinics that you go to, a lot of times they'll take your pulse for 30 seconds and they'll watch you breathe for 30 seconds and times it by 2. We want to make sure that we count respirations for 1 full minute, again, to make sure we get the accurate number. So for the skill, you're just going to watch your patient, you're going to look at your clock, you're going to start, and you're going to watch them breathe in and out for a full minute. Then you will write that down on your list as well, and just put respirations next to it, because we know that that's respirations for 1 full minute. So those are a couple of vital signs that you're going to do. We also like to take the person's temperature. And in the lab setting here, you're going to have a lot of different thermometers that you're going to use. And you'll be able to see them up close when you come to lab. First, we have oral thermometers. We have a number of different oral thermometers that are used. We have glass oral thermometers that we use here in lab. We have the green and we have the red. A green or blue glass thermometer is an oral thermometer. Red stands for rectal thermometers. For oral thermometers that you will use in the lab setting, and sometimes out there when you're working in healthcare as well, you will make sure that you disinfect this with an alcohol wipe, and you'll put a covering on it. Before you use these, you want to make sure that the temperature is down to 96 degrees. To do so, you grab onto the end with the bulb at the other end, and you will flick your wrist to make that go down. You make sure that it's down low enough, then you'll clean it, put the cover on, and you'll put it underneath the patient's tongue. Oral thermometers must be held in place for 3 to 5 minutes in order to take a temperature. Okay? So you will be able to do that with a partner in the lab setting. Another type of oral thermometer is probably the one that you have at home. So this is a portable, electronic, or digital thermometer. Again, you'll be able to disinfect these with an alcohol wipe. When you use an alcohol wipe to disinfect anything, you want to scrub it for at least 30 seconds to get it nice and clean. These are great because they're very portable, easy to use, easy to get a hold of. You would put a cover on there. They have little plastic sleeves that you can get at any drugstore, Walmart. So we put that cover on there, and then you can turn it on. Once it's ready to go, you can just put it underneath your person's tongue, and then it beeps. The nice thing about these thermometers too is that they're fairly quick. You know, within 30 seconds you have a temperature. If your patient is unable to take an oral thermometer because of having oxygen on, having just ate or drank something, or 98.8 degrees, or having oral surgery or teeth removed or something like that, you can use these thermometers as well with the cover on and do axillary temperatures. So that is this thermometer. The one that you're gonna see out there the most in healthcare for oral thermometers is this one. It's a very nice one. This one is also nice because it has the axillary temperature on there. So it has these plastic probes that you put on, and then you can put this underneath the tongue, and again, it's gonna beep really quickly. If you do axillary, you can change it to axillary, and you would have to make sure you do it where there's no clothes, whether you lift up the shirt and put it underneath the armpit, hold the armpit down, and you can get an axillary temperature. For oral, it says oral on there, again, just put it underneath their tongue. It will circle around when it's working, and then again, within a few seconds, you have your temperature taken. And this, the blue button, just pops it off, and you're good to go for that one. Another type of temperature that you can take is temporal. So this is a temporal thermometer. We use alcohol wipes to clean the thermometer before and after use. So we clean that. For this particular thermometer, and each thermometer is different, but for this particular one, you are going to put it on the person's forehead and push down on the red button. You're going to hold down on the red button the entire time while you go over to the hairline and pick it up and put behind the ear. Then you release the button to take a temporal temperature. So for our person here, I'm just going to push this on the forehead, move it across, behind the ear, let go, and it has the temperature on there. And then the last one that we have in our lab setting is the tympanic, or your ear thermometer. These are also very nice to use in elderly. It's sometimes difficult to use because of wax buildup in their ears. So they may not be as accurate as you would like. For adults, if you are going to take their tympanic temperature, you need to pull onto their ears and pull up with their pinna. If it's children, you take and you pull down so that you can get better fitting with the ear canal to get a more accurate temperature. So for this one, it comes out and we put a cover on it. So the cover pops on, and then we hold down on this button and it will beep. So for my person here, I'm just gonna grab up and pull back and then go ahead and beep, and then it gets the temperature on that one. Again, this has a little button on it that you can just get rid of the cover, and it goes back into the case. And those are the vital signs that you are able to do with your patients out there in the clinical setting.